If you've had surgery, a toothache, or even painful periods, you've probably experienced the power of opioid painkillers. Morphine, codeine, tramadol, oxycodone. These drugs are highly effective, highly addictive, and if you get hooked, highly dangerous. A long-running program has had real success in treating opioid use disorder. So why is it controversial, and are there better answers? Marva Moayet investigates.
It's Wednesday morning in Hamilton. And Twiggy Sadell is off to her local pharmacy.
Morning, Twiggy.
Morning, Michael.
How are you today?
I am tired, but good.
Good.
Twiggy makes this trip 3 times a week, 156 times a year.
And how much are you expecting today?
65 megs.
There you go.
Thank you.
She's here for a dose of liquid methadone. She drinks it on the spot and takes a dose home for tomorrow.
All good?
It's a routine the 42-year-old has been following for nearly 20 years.
How was that?
All good?
How do you feel? Do you feel any different?
Nope.
It doesn't give you a high.
No. Like once you're on a stable dose, you're just normal.
Twiggy is an opioid addict.
Very used to it.
Made from opium poppies or created synthetically in the lab, opioids work by blocking pain messages to the brain and boosting feelings of pleasure. They're prescribed to treat persistent or severe pain, from periods to surgery or cancer treatment. But while the likes of codeine, tramadol and oxycodone can be highly effective, they can also be highly addictive. Twiggy was 14 when she started taking painkillers.
I had braces for like 15 months, and when they would tighten them, it was incredibly painful. You couldn't even eat a grape. I was prescribed codeine, and you just float away. You don't feel nothing. It's all nice and soft.
When the codeine prescription stopped, she went looking for more.
I was on the street. It was shoplifting. I was stealing from friends. I was stealing from family.
By 15, she was in foster care. By 19, homeless. Eventually, the pills weren't enough.
Morphine, that we turned to heroin. That was bad. Yeah. Because, you're injecting, and you think you can just have one hit. You can't just have one hit. It doesn't work like that.
In her teens, Twiggy met another addict, Jackie Bennett.
What did you like about her?
She'd rip you off in the blink of an eye, but at the same time, she was willing to help. She would help people in any way possible. She had the biggest heart. She was one of my closest friends.
Jackie's mum, Tracy East.
Some people that come through the door have the most amazing stories to tell. And I'm a chatterbox. I love to talk.
For the past 4 years, Tracy and her husband have been running a motor camp in Hanmer Springs.
Family is important to me. Because I didn't have a very good childhood, I wanted my children's lives to be different. I wanted them to have good lives.
Tracy had her first child, Jackie, when she was just 18.
What was she like as a little girl?
She was difficult. She was really difficult. She was diagnosed with hyperactivity when she was 4. Jackie was a morphine addict. She started using very early. When she was about 12, she was injected by another person. At that time, there was no real support. I tried everything, and I mean everything. I asked her one day, I said, Jackie, why do you use? And she says, because it takes me out of this world, Mum. Hit her pain, because Jackie had some trauma in her life too.
Opioid use disorder is a complex illness. Even when the person wants to stop, physiological addiction and brutal withdrawals can make it feel impossible. To help, opioid substitution treatment, or OST, was introduced here in the 1970s. Patients are usually prescribed liquid methadone or Suboxone tablets to manage cravings and withdrawals. These act on the same part of the brain as other opioids without causing the high. Right now, about 7,700 New Zealanders are on OST. Virtually all of them will stay on indefinitely. In her early 20s, Jackie joined the program.
Did her life improve materially when she went on methadone?
No,
You didn't see a change in her?
no, not at all. Not at all. In fact, I think in a way it made it easier for her to use, really, because that's what I see the methadone as.
Not every person on opioid substitution treatment is allowed to take doses home, but Jackie was.
When a person has mental health issues the way that Jackie had mental health issues, why would you give a person a drug that could kill them? Why would you?
One night in 2018, Tracy's 3 children, Jackie, Daniel and Dion, came over for dinner.
It was the first time in years I had all 3 of the kids together at once. So we had a few wines and then they got in the spa pool and then Daniel got out. We were sitting on the couch and he was sweating and he was rubbing his chest and I said, "You're not having a heart attack, are you, darling?" And he says, "Don't be so bloody stupid, Mum." So I says, "All right, darling, I love you, I'm off to bed." He says, "I know, Mum, I love you too." And I went to bed and he lay down and died. I can't describe it. Pain is terrific. I sat on the couch for a long time, lost myself.
What did you find out about his death? What was the cause?
Drug toxicity combined with his sleep apnea and coronary artery disease.
And something she wasn't expecting.
So this is Daniel's post-mortem report. He had 0.06 milligrams of methadone in his system. Daniel never took methadone, so I was shocked when the result came through.
Jackie had given Daniel some of her takeaway dose. For someone without opioid tolerance, even a small amount can be deadly.
Jackie didn't have any ill intent. Jackie didn't mean to kill her brother. She was trying to give him a good time. But that good time, it killed him.
I've never seen her go down that bad. She was a mess, absolute mess. And she blamed herself so bad for it, so bad. And she wished that it was her instead of him.
On the 23rd of June last year, Jackie was found dead in her home.
When Jackie died, it really broke me. I expected one day for her to OD because it was just the addiction, you know. And then when it really happened, I wasn't ready.
Her autopsy showed a mix of drugs in her system, including very high levels of methadone.
When the police went in there was methadone bottles everywhere, prescribed to Jackie. Not a street drug, a prescribed medication. How does that happen?
The coroner is yet to rule on Jackie's death.
I'm not anti-methadone if it's used correctly and people consume it at the chemist. That's fine. Stop the takeaways. I think that if Jackie didn't have her takeaways, both of my children would still be alive.
Is there a limit on how long you can be prescribed methadone?
No, and there really shouldn't be. People should have access to treatment for as long as they need it.
Jason George leads a national team in drug harm reduction.
Is it treatment though, or is it just drug supply?
Well, I mean, you could call it safe supply if you wanted to, but it's called substitution treatment. You substitute an illicit opioid for a legally prescribed one. The reality is that the just say no approach doesn't work. We accept that people will use drugs and we want them to be safer.
For Jason, it's personal.
Jason, this is the methadone.
Yes, this is the methadone that I have today.
What does it smell like?
It doesn't really have any particular smell. It has a pretty bitter chemical taste.
Yeah.
It's not a really pleasant thing to drink.
He's been on opioid substitution treatment for 18 years.
That's it, done.
Yes, that's it.
Jason is proof of just how commonplace addiction can be.
Pretty normal upbringing, I think. I didn't have anything negative going on in the home. I went to private school. Both parents there. I really started with alcohol. I started using drugs as a way of coping with the troubles I'd caused myself using alcohol.
His lifeline was getting a place on the OST program.
When I went on it, I was getting in a lot of trouble. I wasn't employed. I didn't have stable housing. Relationship with the family was deteriorating. Whereas now I work full time. I'm in a leadership role, pay my bills. Have a much better relationship with my family.
Unlike Tracy, Jason believes there should be more options and flexibility, including injectable methadone or even prescribed heroin for those who need it.
There's an element of personal responsibility involved. I think that people should be treated like individuals. I don't think there's a one-size-fits-all option.
Twiggy Sadell knows her life would look very different without a legal supply of opioids.
I know it wouldn't be sitting in a flat that I can pay for, having healthy relationships with my family and my friends. I can't even imagine where I would be. I'd probably be dead, actually.
So this is one of my little spots. So I've got a lovely little finger lime. I've actually got some peanut plants.
Oh, you can grow peanuts?
Yeah, a little bit like potatoes. So you harvest them and they come up through under the ground.
Under the ground?
Yeah,
I don't know what I thought, maybe on a tree or something.
Unlike me, Vanessa Thomas has green fingers.
This is your lemongrass, bit of mint.
Her gardens at home in Northland are thriving, and so is she. But it hasn't always been that way.
Would have been in my early 20s. I went to the GP to discuss actually period pain, and codeine was actually prescribed as a pain relief. I'm furious now, 50-year-old me. There should have been more of a discussion about, what this medication can do to somebody, how quickly you can get addicted to it. When I tried to stop taking it. So the withdrawals would kick in very, very quickly.
What does it feel like?
It's almost like your bones are on fire. You're nauseated all the time. It's awful.
The longer she took painkillers, the less effective they were. She needed more and more.
Once the doctors cut me off, I would do the rounds of pharmacies. So I would make sure that I had a little notebook to write down what pharmacies I would hit.
She was taking up to 50 painkillers a day.
It's almost like an escape. So, I used alcohol for the same thing. Codeine made it happen faster. Yeah, I was embarrassed.
Why were you embarrassed?
Because I was addicted to pain pills. You're a dirty junkie, right?
Her marriage ended and her relationship with her children was in tatters. She knew she needed help. Vanessa started on opioid substitution.
I actually opted for Suboxone. In my mind, it was the lesser of the evils.
Suboxone is an opioid in tablet form that dissolves under the tongue. But like methadone, it needs to be taken under supervision at the pharmacy.
I'd have to drive all the way to Cooper's Beach, which is about an hour from where I live.
and she worked full-time.
I run a garden department, actually. Yeah, I love it.
So when her doctor suggested an alternative,
I was all for it, all for it. Nice to see you again.
How's things going for you?
Really good.
here in Kaitaia, Dr. Graham Judson treats drug and alcohol addicts.
Historically, people are regarded as morally bankrupt, but there's a lot more to it than that. A lot of my patients have got some severe trauma in their backgrounds.
He's an addiction medicine specialist, one of only a handful in the country.
We prescribe a medication to prevent withdrawals and make so the person feels a sense of normality or comfortable.
Instead of spending all this money trying to keep them from experiencing withdrawals, why don't we just rip the Band-Aid off, get them through the withdrawals, and then they're not dependent at all anymore.
The relapse rate's about 95%.
The relapse rate is 95%.
That's very high. If we're looking at giving them a medication, it's no different to someone that's diabetic, for example, who gets insulin to bring their insulin levels back to normal, or an asthmatic who gets inhalers.
They aim to get people on opioid substitution within 3 weeks, and here in Northland, there's just over 200 patients.
I've seen people go from a daily injecting drug habit through to leading professional careers, or mums and dads getting their kids back to school and get on with life, and people becoming just part of society.
He admits there is a risk of overdose when patients take away their opioid doses.
Doesn't it make more sense in terms of safety just to get rid of takeaways altogether?
The issue of takeaways is always a balance between our responsibilities to society versus fostering self-autonomy and people getting well. And people can't get well and gain self-autonomy by having to attend to a pharmacy every day.
Like any treatment, opioid substitution is not perfect. Some patients use their medication dangerously, like injecting it or selling it on the street.
But most don't. Most people don't get on with life.
There is another option.
Hi Vanessa, how are you?
I'm good, Harry. How are you doing?
Nice to see you.
A long-acting injectable form of opioid, heralded as a game changer by doctors and patients.
Pretty sure we're on this side this week.
Very good.
Vanessa's caseworker, Harry, administers the drug into her abdomen, and she only needs to get it once a month.
I can plan holidays, you know. I'm not chained to going, oh gosh, I've got to make sure I've got enough gas in my car to go get said medication. So it was just a no-brainer for me.
While the drug company that makes it has supplied a limited number of doses for free, its generosity only goes so far.
What would be your message to Pharmac then?
My message would be let's get this funded, particularly for patients that live outside of the main centres. It's a real benefit because people can get on with their lives.
Can you imagine how many people would get their lives back, that they can't trust themselves to take methadone or Suboxone? Can you imagine how much their lives would be spun around for them? I think, yeah, definitely should be funded.
Pharmac is still considering whether to fund the injection. Right now, Vanessa is the only person in Northland receiving it.
I've got a really good job. I have all my kids in my life. They know I'm present. Anything they need, they know I'm there. Just nice to know that I'm a reliable person in society again.
Are you proud of yourself?
I'm hugely proud of myself. Yeah, I've worked really hard for this. Really hard.
So how often do you come and walk through here?
Every day.
Every single day?
Yep, whether it's raining, snowing.
Why do you do it? Why do you come and walk through here?
Peaceful. Put myself back together. I can hear the kids. I can hear them in my head and talking to me.
Tracy East lost her son in 2018. Then, 5 years later, her daughter.
All of my tattoos are for my children. So this one here is for Daniel, because Daniel always wore a fedora. This one here is for Jackie. She loved Alice in Wonderland.
The motor camp she runs is for sale. She's planning to move to a secluded cottage in central Otago.
Heal, that's what I want to do, is heal, try and put my heart back together. It's not easy.
Both of her children's deaths involved methadone.
I believe that prescribing of methadone, the way it's prescribed, needs to change. If you're an addict and you're thinking about going on this program to try and straighten yourself out, be careful.
Well, Tracy has asked the coroner to investigate why her daughter Jackie was allowed takeaway methadone given her mental health problems, and her abuse of the OST program were well documented.